Well, hey guys, in today's video, I'm going to be going over 8 questions you need to be asking the next time you think about getting a cosmetic procedure performed. But before I get into this video, definitely give this one a thumbs up if you like skincare content from a board certified dermatologist. Be sure you're subscribed and you have your bell notifications on, that way you're alerted as soon as my videos go live. Give me a follow over on Instagram and TikTok because I'm very consistent with posting skincare content on those platforms as well. There are a ton of cosmetic procedures out there. It seems as though every year we get more and more procedures, and you've got everything from lasers, fillers, BOTOX, Dysport, Xeomin, lifts, and you can't open up a social media app these days without being hit in the face with either an ad for some type of cosmetic procedure. But always important to keep in mind that while these are cosmetic procedures, they're also medical procedures, and they have risks of side effects that can be very harmful if done under the hands of somebody who is not well trained and not qualified to do these procedures. You can develop scarring, infection, pigmentation issues that may be permanent. I don't want that to ever happen to any of you guys. Selecting a physician with the requisite training and qualifications is the gold standard for pursuing cosmetic procedures. Board certified dermatologists often seek out additional fellowship training after their dermatology residency to get even additional skills and expertise in aesthetics, and plastic surgeons likewise are very well trained in aesthetics. So you want to make sure that you look for a board certified dermatologist or plastic surgeon. I have a video as a side note on what it means to be board certified. Not everybody knows what that means. Definitely check that video out. It is a kind of a confusing terminology, but hopefully that clarifies it for you. These physicians undergo extensive training in the field of aesthetics, and they are well skilled in the anatomy and the different types of procedures, and they also know the right questions to be asking you to make sure that you get the best outcome and to minimize any adverse outcomes. At the end of the day, cosmetic procedures, they are elective, meaning you choose to get them. They're not medically necessary. The last thing you would want is to have a permanent disfiguring outcome, whether it be a scar, infection, hyperpigmentation. Cosmetic treatments are not a one-size-fits-all cookie-cutter approach. Certain lasers, for example, are not appropriate for all skin tones, especially at certain settings. You can lead to burns, hyperpigmentation. Having the advanced knowledge in these procedures really ensures the highest level of patient satisfaction. That being said, certain cosmetic procedures can be performed by a qualified, well-trained healthcare provider under the supervision of a physician. Physician just has to be present on site in case a complication were to arise. The doctor would be there to help manage that. The first question you want to ask, or how you want to frame the question, is along the lines of what treatment is right for me. A lot of patients come for an aesthetic treatment and they ask for a specific procedure. Just because a certain procedure may have been the best thing that so-and-so had doesn't necessarily mean it's the best thing for you. It's better to come in with an idea of what it is that you're looking to improve upon, correct, change. Discuss that with the doctor and let the doctor inform you what the best procedure to achieve that is going to be for you. The end result is going to be much more satisfying in the long run. I see a lot of influencers tending to get certain procedures, popularize them, maybe influence you to think that you need to have that procedure. But in reality, there may be something else that would better address whatever concern it is that you have, say with your lips. Question number 2, is this specific laser device or treatment right for my skin type and my skin tone? This is so important. Some treatments come with a higher risk of post-inflammatory hyperpigmentation in people with a deeper skin tone. Other treatments may not be best for people who have very sensitive skin, like rosacea. So you want to have that discussion with the doctor. Hey, this is the type of skin that I have. They should evaluate you, of course, do a physical exam if necessary. So that's going to be part of the conversation right there. Again, cosmetics, it's not a one-size-fits-all approach. Just because one person had a treatment, your best friend, it doesn't mean that that's necessarily right for you. It may end up harming you in the long run. Question number 3, how much is this going to cost? Again, these are elective procedures. You're going to have to pay out of pocket for them. Insurance is not going to cover this type of thing. So you need to have a good understanding of how much it's going to cost. If you're going to need additional treatment sessions, how much is each session? Is there a cost associated with any kind of follow-up care that you might need? You're going to want to clarify that up front. But I do caution you, don't shop around for the best deal. This is not like buying a pair of shoes where your favorite shoes are one price here and then they're, $10 cheaper somewhere else. Because a lot of times if you're seeing somebody advertising a deal on an aesthetic treatment, a lot of times, that may not be the most skilled individual. So buyer beware. Just because it comes at a discounted price doesn't mean it's going to be the best option for you. It's also important to talk about price up front because you may have talked about a few treatments that would give you a desired outcome, and one of them may be more in line with your budget. Question number 4 is, how should I prepare for this procedure? A lot of cosmetic procedures aren't necessarily as simple as just popping in after work. Should you come with a clean face? Should you avoid using anything, taking any medications? Should you stop taking any medications a few weeks before? What about your topical retinoid? Should you stop using that? How many weeks in advance? These are things you want to ask up front. If you're going to be at the beach the week before a certain treatment, you might want to bring that up because some treatments we would not want to pursue if you have recently had a lot of sun exposure. Definitely something to talk about, how to prepare for your treatment. What amount of time is the procedure going to take? Is this something that you're going to need just an afternoon for? Or is it going to be more lengthy? That's going to factor into your scheduling. Likewise, can I get a wax before? Question number 5, which you really shouldn't have to ask, but it should kind of become obvious to you, I guess, is, has the provider properly reviewed your medical history? Again, when it comes to cosmetic treatments, it's not a one-size-fits-all approach. Some treatments are not going to be a good option for people if they have certain underlying medical conditions. Have they reviewed your medications? You may be on a medication that slows down healing, or you may be on a medication that increases bleeding time. The doctor is going to want to know that in advance. Do you take any dietary supplements? Many dietary supplements likewise can prolong bleeding, and so that can impact the nature of the procedure, how long it goes, and you may be counseled to stop those if it's safe to in advance of the procedure. Do you have any allergies? Do you have any history of problems with anesthesia? Have you ever had a surgery before? That's a really important one that you may not even think to talk about, because if you've had a surgery in the area that you're interested in treating, that can definitely influence the choice of treatment based on if there's going to be any scar tissue left over from your prior surgery. And what medical conditions do you have? If you've got diabetes, that can impact healing. If you have a history of cold sore outbreaks, many dermatologists are going to want to prescribe you an antiviral medicine if you're going to be having any kind of laser treatment around the mouth, on the face, or if you're going to be having any kind of resurfacing, peel, because it can increase the chances that you get an outbreak around the time of the procedure. So they might want to prescribe you an antiviral medicine to prevent that from happening. As a side note, I have a video on cold sores, so definitely check that out if you're somebody who deals with frequent cold sores. I talk about the treatments, triggers, so definitely check that one out. The 6th aspect of the treatment discussion should be around how your pain is going to be managed. Is there going to be a topical numbing cream? Is that going to be applied before? Are you going to have to apply it and then wait a certain amount of time for it to take effect prior to the procedure? These are things that you're going to want to know in advance. Or is a doctor going to use a nerve block? Aesthetic treatments in dermatology, we don't need to use general anesthesia. But again, coming back to, have they evaluated your medical history? Do you have any history of problems with certain anesthetics? That could factor into the treatment plan and something that the doctor is going to want to know up front. Some people are really nervous about needles, and letting the doctor know that in advance. There are a variety of things that we can do to help make it more comfortable and put you at ease during the procedure. So don't hesitate to bring those things up. You want to make sure that you and your treatment team are on the same page as far as pain management, so that you're comfortable. That's really important, that you are comfortable during the procedure, that you have good communication during the procedure if you have any discomfort, because if you have any pain or discomfort while, say for example, you're receiving an injection, well, you might flinch. That could actually be harmful. So your doctor does not want you to have any pain or discomfort. That level of communication is really important. And starting the conversation early about how your pain is going to be managed is definitely important. Number 7 is a discussion on the risks. I mean, this is going to happen. Your doctor is going to discuss risks with you. It's an essential part of this conversation, but just so you have it in your mind mapped out going into the visit, some of the key things that are going to need to be covered and discussed so that you are well informed. What are the risks? What are the side effects? How common are they? And what do you have in place to manage them? For example, hyperpigmentation may be a more common risk. Many dermatologists actually will prescribe their patients a topical hydroquinone, which they'll start them before the procedure, and that actually can reduce that. I have a video on filler gone wrong where I cover all of the side effects of filler, including the very rare but very scary ones. So check that one out. Things like tissue necrosis. So ask them, do you have the things in place to manage those? Again, coming back to what I mentioned earlier, many trained healthcare providers can administer certain aesthetic treatments, cosmetic treatments, but they need to do so under the supervision of an attending physician. The attending physician may be in the room, but they have, at the very least, they have to be on the premise. In the rare instances that these adverse effects occur, they can come in and help to manage them very quickly and intervene. For example, with filler, God forbid, filler is inadvertently placed in a blood vessel. That needs to be intervened on very quickly. That's something I cover in my video on filler gone wrong. So definitely check that one out. But yeah, you want to have a good conversation about what are the potential risks and side effects with this treatment. In the case of body contouring, for example, cryolipolysis, otherwise known as cool sculpting, you're going to want to have a conversation about potential side effects. I have a video, as a side note, talking about paradoxical adipose hyperplasia that can rarely happen with that. You may remember Linda Evangelista has been dealing with that. She came out very publicly about that, and I did a video on it. So check that one out if you missed it. But every procedure has risks, so being informed of what those are, how they're going to be managed, should they occur, that's really important. It also helps to provide you with some level of comfort and reassurance that this place that you're going to, not only should the doctors be well qualified, but you want to go somewhere where they've got all of the tools in place to manage any potential adverse effect. And then last but not least, what to expect after the procedure. How much downtime are you going to need? Are you going to need to take off the rest of the day from work? Are you going to need to take the rest of the week off? Are you going to need to lay low? Are you going to have redness? Is the face going to be peeling? Are you going to be able to use any skincare products? Are you going to be able to go on vacation afterwards to a sunny place? How soon after? How long does it take to heal? How many treatments are you going to need? Are you going to have to follow up? How often? How many months? Are you going to need to come back, say maybe in 6 months, for kind of a touch-up or maintenance? These are all things that you want to talk about up front. And again, feeding back into the cost. How much are those subsequent visits going to cost you? Definitely something to factor in before you commit to the decision to pursuing a cosmetic treatment. Are you going to be able to resume activities? In some cases, you may be counseled to not work out or overexert yourself for a few weeks. That can be really challenging actually for some people. Maybe you are a competitive athlete and that might not work out for you. Maybe you are like a runner and the idea of not being able to do a race a few weeks afterwards, that's just not going to sit right with you. You're going to want to know that up front. All right, y'all. So those are the 8 questions to think about when you go for a cosmetic consultation. I hope this video was helpful to you guys. On the end slate, I'm going to put that video on filler gone wrong. So check that one out where I talk about filler complications. But if you enjoyed this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.